Hi, and welcome to a Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I'll be diving deeper into the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. In today's episode, I'm honored and excited to be speaking with Dr. Antonio Webb about the importance of exercise on your spinal health. Dr. Webb is a fellowship-trained spine surgeon located in San Antonio, Texas. He has taken the best practices from all of his mentors to formulate his own unique approach to spine care, believing that conservative treatment is the ultimate goal, and using surgery only as a final and last resort. Dr. Webb is a highly decorated combat veteran who spent 8 years in the U.S. Air Force as a medic, including a deployment north of Baghdad in Iraq in 2005. So what I want to point out is that Dr. Webb has a truly inspiring personal story, nothing short of a miracle, I'd say. And that story can be read in his first book and biography entitled Overcoming the Odds, which has been made into a documentary to be released on February 22nd of 2021. So with that, I'm so happy to welcome you here today, Dr. Webb.
Yeah, thank you so much, Susan, for having me.
Well, it's my pleasure and an honor. So I'm going to dive right into our questions. I was actually doing a little bit of research and found some surprising facts about the spine. So the first one that I saw was that the spine has more than 120 muscles in it, and you can confirm that. So that said, how important is exercise for the spine? How and why?
Yeah, absolutely. There's lots of different muscles, and I can be the first to admit I don't know every single muscle in the back. That we learn these things in medical school, but when it comes to clinical practice, the names of the major muscle groups, we know those, but those smaller ones, there's so many to know and kind of understand. But exercise is extremely important for your spine health and for your back health. And as you mentioned, I'm a very conservative surgeon, so when patients come to see me in my office, about 90% of them are going down the conservative route. So that includes physical therapy, some chiropractic therapy, working on your core, flexibility, your motion, but maintaining kind of your spine health, and as well as doing this with exercise. Proper exercise is really essential.
I agree. And I have to confess, I was thinking about this podcast this morning as I was doing my morning yoga, thinking about my own flexibility in those core muscles and how important that core strength is.
Yeah, absolutely. A lot of people don't realize that, working your core actually is really critical for low back pain. So I see a lot of patients that come in and they have low back pain, and I try to emphasize that working on your core is really essential.
I have to tell you, possibly an anecdotal story myself, but this was kind of ingrained in me from childhood. My own father had lower back pain, and a doctor, this is back in the 1960s, told him that unless he started to work on his core muscles, he probably would not be able to walk. So my father did core leg lifts and sit-ups pretty much every day of his life. Isn't that funny?
Yeah, it is. I don't try to scare patients like that, but you definitely, there's a way to kind of motivate patients, but if that definitely worked for him and got him to stay active and work on his core, then that's good, man.
Right. It kind of scared him into doing that. I think we can take a more, like you said, moderate or conservative approach. The point being, working on core, I can't stress it enough, as I'm sure same with you. And it's funny you mentioned that about the lower back, because that was also in those facts that I was looking at about the spine, that the majority of back injuries and problems do end up being lower back. Why is that, though?
Yeah, I mean, there's a lot of things that can go wrong with the back. There's the disc or the cushion between the bones. There's the facet joints. These are kind of bones in your back that allow you to kind of flex and extend. There's the nerves. You can have disc herniations, can be coming from your SI joint. So lots of different structures that can be injured. And my job as a physician or clinician is to figure out which of those anatomical structures is causing the problem so we can treat it effectively. And the lower back, it is one of the most common reasons why people go to the doctor, and it's usually due to improper lifting mechanics or lack of exercise, not working your core, weak core muscles. Those things predispose you to injuries of the spine. And that's why I really try to harp on staying active, walking as much as you can, working on your nutrition. And like you said, you were doing yoga this morning, and that is excellent. Yoga and Pilates, those are really good exercises for your spine.
I love hearing that. I'm writing this down. You said walking as much as you can, and I'm thrilled to hear that. Is there a reason why walking in particular, say, versus running and other forms of exercise? In other words, so for people who aren't naturally runners, walking alone, I think want to reinforce how and why walking is so beneficial.
Yeah, absolutely. And that's one of the things I really try to stress with my patients. Historically in the past, when patients would undergo surgeries, they would lay in the bed for sometimes 5 days, 6 days, 7 days, sometimes for 2 weeks. And then as technology has improved and we have kind of advanced in the things that we do in medicine, most surgeries, I would say 95% of them, I'm trying to get my patient up the same day of surgery or the next morning. There's a saying out there that says that, if you don't use it, you'll lose it. So the muscles, the cartilage, the disc that is between the bones, they need that stress that is applied to them so that they can stay functional and heal properly if there was an injury. So I really stress the importance of getting out and walking. It's good for cardiovascular health. It's good for your mental health. And then, if you can't run or if you're not a big runner like myself, then, I would suggest just going out on some walks. And that's what I try to do with me and my family.
Completely agree. It's fascinating, how these simple things make such a big difference, right? In our daily habits. That's what I focus on most. I will have to backtrack, and I'm curious in hearing this, how, as far as medicine goes and your study to become a physician, how did you choose spine surgery and spine health?
Yeah, that's a great question. Most medical students choose a specialty within their third and fourth year of medical school. So you do your first 2 years in the classroom, and then the third and fourth year you spend in the hospital and you do rotations with different specialties. And that's kind of the time frame where most medical students choose what specialty that they want to go into. There's a few medical students that come in and they know exactly what they want to do, but I didn't choose a specialty until almost the end of my third year, beginning of fourth year of medical school. And I always knew I loved working with my hands. Growing up, I was breaking things down and kind of putting them back together. So I really like that about orthopedic surgery, kind of the reconstructive aspect of it. And when the patient comes in with a hip fracture or a wrist fracture, I can put their bones back together and allow them to be more functional. And then in terms of spine surgery, you apply for your fellowship. You can subspecialize. You apply for this during your fourth year of residency. And for me, I've always liked the brain and the spinal cord. I think the surgeries are really fascinating, and, just doing surgeries, it's like one of my favorite things to do. And, working around the spine and the nerves and how everything kind of interacts, that's really fascinating to me.
I love hearing that you're doing what you love. And isn't that the goal?
Yeah. And sometimes surgery, I just, sometimes I get overly excited, like, wow, I get to do this. I'm looking at the spinal cord right now. This is so cool. So even after going through, 15 years of training, I still have those butterflies and I still get really excited about surgery. I love what I do.
Love hearing that. Kind of switching gears here as I'm sitting here speaking with you at the end of our work days, right? I find myself sitting for so many hours, Dr. Webb, and particularly since COVID. And I know I'm not alone in that. Are there any specific exercises that you would recommend for better back health for those who are sitting for many hours a day?
Yeah, this is something that I've seen since the pandemic. A lot of patients are coming in and saying that they're working from home and they're sitting at a desk all day, or if they're not working, their neck is kind of in a flex position from texting all day or online. I think having the proper ergonomics as well as proper body mechanics will help. We talked about working on your core. I even invested in a sit-to-stand desk. So I'm standing right now. Most of the work that I do, if I'm standing at work, seeing patients in the office, I'm usually trying to stand. And I think standing is better than kind of having your back in a flex position for 6 to 8 hours a day, which is really not good for your spine. So I think staying active. Some physicians, especially radiologists who do a lot of sitting, they sit on the large bouncy balls, or one of the radiologists, when I went down there to go see him and ask him a question, he had a little bike pedal that he was sitting at his desk and he was pedaling his bike the whole time. So you have to figure out and be creative with it. The most important thing is to stay active. I have an Apple iWatch, and it tells me when I need to be a little bit more active or I need to burn some more calories throughout the day. So I try to use that as well. So just be creative, try to stand as much as possible versus sitting, and make sure that you're stretching and taking care of your overall health as well, your nutrition, what you're putting into your body.
I concur on that. It all matters, all of those factors. And of course, my brain goes to nutrition first as a dietitian, is my background. And I think even when I notice that I'm better hydrated, somehow that helps me. But just the reminding, I wear the Fitbit and those reminders to get up and move. I love that you confirmed for me too, that going from the sitting to standing position alone is beneficial. And I didn't know why the standing desks are really, because you're not moving. So in my mind, I'm thinking you're not really burning calories. Makes so much sense though for your posture and not being in that flex position, which now that it was kind of like a light bulb just went off for me. And I do encourage people to do those standing desks. Ironically, we have them in our office. I just don't have one at home. You
do burn more calories than when you stand also versus sitting.
Okay. Yeah.
Yep. You mentioned kind of staying hydrated. Your discs that are between the bones, when you hear about disc herniations, those discs are made out of a lot of water. So, you need to apply that pressure to them, and the end plates, that's where the ends of the bones, that's where it gets its diffusion and its nutrition through that. So the more kind of force that you apply to those areas, the better. And standing actually helps with that. And drinking more water helps with that. And as these discs kind of dry out as we age, and this is where people get stenosis of their spine, which is kind of tightening, or disc herniations, because those discs kind of dry out over time.
Boy, that is such a golden nugget of information right there, truly, because I tell people to hydrate better and to drink more, and you just explained exactly why. Thank you.
Yep.
Right? Thank you. That's fabulous. Along those lines, too, can you give listeners a few any more exercise tips? You've given actually quite a few, but for both very busy people and or those who just simply are lacking time?
Yeah, and that's a great question. I have a very busy schedule, and what I've recently incorporated is actually just getting up a little bit earlier and going to the gym. I have young kids and I have a wife, so when I come home from a long day of work, I try to give them as much attention as I can. So it's kind of hard to incorporate going to the gym, and then justify that after getting off of work maybe 6 or 7 p.m. and still trying to spend time with my family. So I actually get up at lately around 4:30, and I'll go to the gym and work out, and then that's been really good. You feel better about yourself throughout the day. You tend to eat better just because you don't want to leave the gym and just go, grab some fast food, and then you have more kind of energy throughout the day. And I've definitely noticed that. So that's been the biggest kind of change that I have made recently. But in terms of busy professionals, instead of taking the elevators, you try to take the stairs, drink plenty of fluids. I always keep moving, throughout the day. Even if you're in your office, every 30 minutes, get up and walk down the hall and walk right back. Those calories definitely, they add up over time.
Thank you. I think those very simple little tips and tricks help a lot of people, such as taking the stairs and just, finding more creative ways to get yourself moving more. In little small spurts too. I'll say that too. But I love that. That's the whole goal with my podcast is to inspire and empower and motivate people. I find that very motivating that you have, think of how much you do in a day, and just deciding to get up earlier and devote that time to first thing in the morning to your health and well-being is, the best thing you can do.
Yep. Instead of, waking up, rushing, I get up and spend a couple of minutes meditating and just spending some time with myself. Otherwise, throughout the day, there's someone that's always kind of demanding of me because of my profession. And then when I get home, my family is very demanding too. So it's been really beneficial for my overall health as well as my mental health.
Yeah, it's funny, I can relate completely. And I'm jumping ahead to one of my questions. We'll go ahead and do it, even though you basically just touched upon it, what your daily wellness and self-care practices are. And I do the same thing, as just to bring that up. And it has taken all of these life demands to get me to this place where I say I start my day with yoga and meditation every day. And so that has kind of become my non-negotiable for myself, and I feel like a better person for it. And I know my spine is thanking me for that as well. With that, do you have any other daily wellness practices or self-care habits?
Just planning your day out. Before my day starts, I know exactly what I need to accomplish. And that kind of came from my military background, just having a really rigid schedule and being very disciplined. Just because you want to make sure to accomplish everything that you need to, you allocate time for each individual kind of goal for the day. And also that comes into play with nutrition as well, just planning out your meals so you're not scrambling to find food and resort eating food that's not really healthy for you. When I feel like I'm getting stressed or whenever I'm having a bad moment, I think it's important to just take a step backwards and just take a few big breaths. And that's what I really like about my watch. It tells me periodically to just take a moment for a minute, take some deep breaths and close your eyes and then keep going. I was recently watching a documentary on Netflix, and one of the surgeons, it's called Lenox Hill, one of the neurosurgeons, before every case, he has everyone close their eyes and, just think of happy thoughts, which I think I'm going to incorporate that into my operating room.
Thank you. That's incredible to hear. I love that. That's also very inspiring, isn't it? I'm also liking these occult surgical shows on Netflix. Switching gears a little bit on that note, just talking about your background, and I know we don't have time to get into it so much, but I really am just so impressed and would like listeners to know about your book, Overcoming the Odds, and I really encourage them to pick it up and read it because your story truly is incredible and inspiring. Do you mind telling us a little bit, just giving a little snippet about the documentary that's upcoming though, and how you kind of ended up on the path to becoming a physician?
So I grew up a really challenging background in Shreveport, Louisiana, where surrounded by a lot of drugs, a lot of gangs, a lot of violence, and I saw several of my close family members kind of fall victim to that as well, including my little sister who went to prison, my little brother went to prison. My mom, she's a T10 paraplegic. She was actually shot in her belly and has a bullet that's still in her spine due to her drug addiction. So that's the type of environment that I grew up in, and I wanted to write a book to serve as a guide and a resource for people that grow up in similar environments that they can just pick up and kind of use as a resource to get them through life. And I talk about all the challenges that I went through, not only in Louisiana, but just going to Iraq and being shot at every day while we were there, kind of north of Baghdad, and then going to Liberia right before the Ebola outbreak, and how I escaped that and came back right before, and had a lot of physicians that I worked with pass away from Ebola. So I just talk about kind of the trials and tribulations that I went through in my life and how I got to become a spine surgeon. And then the documentary is just a kind of visual depiction of the book, and it's a spinoff of the book, and where I go back to Shreveport and go into the areas that I grew up in and talk about some of the things that I saw kind of growing up and how it's shaped me as a person and also as a physician. So I'm really looking forward to the documentary, and we shot it about a year ago, all the footage, and I'm really looking forward to getting it out and inspiring more people.
Oh, I am as well. I'm very excited, and it's not far off. February is right around the corner, and it's February 22nd to be exact. I'll say that again. And you just gave me goosebumps. No, it really is incredible. You've lived many lives already, right? I mean, now having everybody understand what viruses and the pandemic means, like just hearing your experience with Ebola alone is, unbelievable. And then you have all those other lives that you've lived as well. I guess on a final note, so this is one thing that I do daily is I keep a gratitude journal myself as well. One of my final questions is quite simply, give us one thing that you're grateful for today, Dr. Webb.
I'm grateful to be an inspiration to a young kid who looks just like me, that has no mentors or may not think it's possible to achieve the things that I have done, and they can, look at me and use me as inspiration. And I always tell students, I give a lot of talks all over the U.S., and I tell them if I can do it, they can also. So that's kind of what brings me joy, and that's kind of my passion, is kind of reaching back to kids from very similar backgrounds that I grew up in to try to inspire them, especially to go into the field of medicine.
Well, you really are an inspiration and living your passion, and just an amazing role model for all of those young, the younger generation's children. They need that. So that's extremely inspiring. On that note, why don't you tell listeners where to find you, where they can find you, either, website, social media channels, the documentary as well?
Yeah, all of my social media sites are Antonio Webb, MD. That's Instagram, Twitter, LinkedIn, YouTube, and that's my website as well. So Antonio Webb, MD.
Fabulous. And that will be included in the description of this podcast as well. So with that, I just want to say it's been such a pleasure having you. I'm truly honored and excited for what's to come. And so thank you for being with me, and I hope to have you back someday.
Yeah, thank you so much. I had a blast speaking with you.
Thank you so much for taking the time to join me and listen to this episode. Listeners can find more information about this podcast and future episodes on our website, and you can also subscribe to the Sense of Wellness podcast at www.ccphp.net/SENS/podcast. That's www.ccphp.net/sens/podcast. This show is brought to you by CCPHP, a concierge medicine organization which partners with exceptional physicians to deliver an unrivaled healthcare experience while also empowering our members to achieve their optimal well-being. Be sure to listen in next time to the Sense of Wellness podcast.